Good afternoon, everyone. Thank you, as always, for tuning in. I want to say a huge thank you to the whole team that has been working very hard behind the scenes to help develop the kinds of models and projections that the governor presented. This response has benefited from an enormous amount of collaboration between the experts we have in state government and the incredibly talented partners that the governor referenced. We want to say thank you to all of you. Partnerships and collaboration are the foundation of our response. That means partnerships with academics, healthcare providers, educators, first responders, public health professionals, business owners, and so many other people coming together like this to keep Rhode Island on the forefront of this response is what has been critical. We know that these partnerships and collaboration with the general public are also the foundation of this response. The visuals that the governor spoke about will be on the Rhode Island Department of Health's COVID-19 data page, and it will be available for everyone to reference. A key component to reiterate, to echo what the governor has said, is that our actions absolutely make a difference. They can make a difference for the better if we choose the right actions, like following the stay-at-home order. When we follow social distancing guidance, when we wear our cloth face coverings, when we stay at home, when we're sick, each of us is helping Rhode Island as a whole follow the trend line that we as a state want to be able to follow. When we don't follow the guidance, we're not going to see the kinds of declines that we all want to see to reopen the economy. But we know that it is possible for everyone to hunker down together. Being able to see the models, see the impact of your work is a critical motivator. As the governor has shared in our data, there is usually that almost approximately 2-week lag. This is because the time between when someone is exposed, then develops symptoms, and then engages the healthcare system or gets tested, determines how the amount of time that it takes for our changes with social distancing to be reflected in the model. Despite that time frame, though, our numbers do display the very real-world implications of our decisions. What you are doing following the stay-at-home orders matters for all of Rhode Island. And we need to use that information to be thoughtful and to be responsible each and every day. Right now, it's a beautiful day today, for example, tomorrow, through the week, and going forward. We all need to continue to support each other in making the right decisions. If you're going to be outside, if you're going to run an errand that's a necessary item and then return home, make sure that you keep your distance from other people. Make sure that you're wearing your cloth face covering. Make sure that you're washing your hands regularly. And, of course, we all know and need to continue to say, if you don't feel well, you should not be going out. That is critical. So let's move into the data for today. We have 327 new cases, continuing to ramp up our expanded testing system and seeing the results of that in the number of new cases. And then sadly, we have 17 new COVID-19 associated fatalities to report. Our deepest condolences are with the families of those we have lost. That's important. These people range in age from their 40s to their 90s. There's one person in their 40s, one person in their 50s, 2 in their 60s, 5 people in their 70s, 4 people in their 80s, and 4 were in their 90s. Before turning over for questions, I want to make one last point. A few weeks ago, I made an announcement about steps we have been taking to allow for emergency licensure for nursing assistants, nurses, medical technicians, and other health professionals. This was intended to get critical workforce support into nursing homes and other congregate living settings. We are so appreciative of the people who took advantage of that opportunity and who are now positioned to step up and help. We want to let these people know that we as a whole are making sure in our partnership with congregate living settings that when you show up to help, it's going to be into an environment that we are working as a team to ensure has the infection control measures and the personal protective equipment needed to keep the staff and residents safe. We very much appreciate our partnerships with the National Guard, with other partners, with healthcare professionals, Rhode Island Responds, across state government, all of whom have come together to help stabilize and make sure that our congregate living settings have what they need to keep their staff safe and their residents. So we, as the Rhode Island Department of Health and our partners, will be continuing to reach out to the people who were able to take advantage of these emergency licensure opportunities. And we want to encourage you, if you have done that, a couple of hundred have. We want many more to take advantage of it so that you can stand ready, know that we've done what's needed to help make sure that it's a safe environment. We need you. Continue to engage with us so that we can get you into the nursing facilities, the congregate living settings, that residents will benefit from your presence in making a difference through this response.